Hi everyone, a number of you sent me this post on Mind Body Green that reported on a study published in the journal ESMO Open that aimed to determine if there's an association with BRCA mutations and the incidence of less common cancers. We know that BRCA mutations are associated with breast and ovarian cancer, also with prostate, pancreatic, and melanoma, and there is starting to be some signal of an association with uterine cancer, although that has not yet been firmly established. Let's talk about this study. It was a Japanese study, and they had nearly 3,500 individuals who had been diagnosed with one of 9 less common cancer types, including thyroid, head and neck, bladder, sarcoma, skin cancers, and others. And they had nearly 39,000 individuals who were controls and had not had a prior cancer diagnosis. And they looked at the incidence of BRCA mutations in the patients who had a cancer diagnosis and the incidence of BRCA mutations in the patients who had not had a cancer diagnosis and compared the two. This is an example of what's called a case control study. Now here's where we're really going to break down the headlines and look at the numbers. This is important. So they had 58 patients in the control, so the patients who didn't have cancer, who had a BRCA1 mutation. And that was an incidence of 0.15%. So 0.15% of the control patients had a BRCA1 mutation. Then they looked at the patients who had had cancer and they looked at the incidence of BRCA mutations. And in BRCA1, they were able to identify a statistically significant association with thyroid cancer, meaning they had 734 patients who had had a diagnosis of thyroid cancer, and 5 of them were identified to have a BRCA1 mutation, which was a 0.68% incidence. That translates into saying that BRCA mutations are about 5 times more common or more prevalent in patients with thyroid cancer. And that was a statistically significant association, but the absolute, we're talking about 5 patients with a BRCA mutation out of 734 patients with thyroid cancer. So we have to look at the numbers. Similarly, for BRCA2, they found an association with bladder cancer, head and neck cancer, and skin cancer, although we don't know how many of those skin cancers were melanomas compared to a non-melanoma cancer like squamous or basal cell. So what are my takeaways? Yes, there seems to be, based on this study, an association, but the absolute numbers are still very, very small. We can't say at this point that there is a definite increase if you have a BRCA mutation of these cancers. But I think it's an important association to be aware of, understanding that the data is developing. This is a homogeneous population based in Japan, so we don't know how it applies broadly. But if someone has been diagnosed with one of these 4 cancers, it's reasonable to have a discussion about genetic testing. If you are a BRCA mutation carrier and are wondering, how does this apply to me? Should I get screening? What should I be doing? I think it's a conversation with your team, especially if you have a family history of those cancers, understanding that our knowledge here is still very limited. And lastly, it raises the question of, in the future, depending on further research, would we be able to use PARP inhibitors for treatment for patients with BRCA mutations in one of these cancers like we do with ovarian and pancreatic and breast, but the data is still pretty far from that at this point. Let me know your questions.